Your emotions are what they are because relationships are complicated. And like I said before, if it was complicated in life, it's going to be even more complicated feeling in death oftentimes. Hello and welcome to Awake at the Wheel. So in today's episode, we're going to be discussing something that unfortunately all of us will go through at one point in time, probably many in our lives. We're going to be talking about grief and bereavement. So to begin, I'll just kind of outline what grief is. In a clinical setting, we would refer to typical grief as uncomplicated bereavement. So what this is essentially is the normal feeling of sadness, loneliness, and even profound sadness that can come from a loss of a loved one when they pass away. So although this is painful and sometimes debilitating, grief does eventually pass and movement forward back into regular life, happy and productive life does happen. Unfortunately, in some cases, though, something called prolonged grief disorder can develop, and this often develops when grief and bereavement last for, it's certainly not a magic number, but lasts more than 6 to 12 months. And this can often look a lot more like depression. And it's tricky sometimes to discern the difference between grief and prolonged grief disorder, simply because both of them can look like a depressive episode. So clinically speaking, we often will look at it from, how long has it lasted for, how severe are the symptoms, how clinically significant are the symptoms. But the point is here of our episode today is how are people going to most effectively deal with grief, which, like I said, is something that everybody deals with at some point. So I found some common questions that have been Googled with regard to coping with grief. But before we get into those, Oren, anything that you want to add about grief and even your experiences with clients with grief?
I'm going to wait to see what the questions are and see where we go with that. I got lots to say afterwards, though.
Okay, perfect. So let's jump in then to the first question. So the first question that I came across is, what are the 5 stages of grief? So I think this is probably one of the most common things that people ask. And again, even in therapy sessions, people will bring this up. And it's one of those things where I think that we can use this as a loose framework, but it's certainly not a definite and certainly not something that everyone goes through. But typically those 5 stages are denial, anger, bargaining, depression, and acceptance. So as far as, how this can look and how this can show up, the order in which it happens certainly can differ from person to person. And like I said, it doesn't always, go step by step and is not that linear. But I think as a general framework, it does work.
Yeah, so I use that not just for grief, for any type of loss. And that's one of the things that we're going to talk about loss and the importance of it, whether it's the loss of a loved one, it can be loss of a job. There's so many different types, loss of a childhood, so to speak. So we'll talk about that. And I always do talk about the Kubler-Ross 5 stages of grief. And I say the research shows, it's not very well supported in, literally, but the point is, that you go through stages. And it may not be those 5. You may skip a couple. There may be different stages. But the fact is, you are going to go through a stage. So wherever you are now, I tell people, we're trying to get you to another stage, because the second most important part, or the most important part, is that at the end, we're trying to arrive at acceptance. And so again, I like the model to tell people that it's not going to necessarily be a smooth transition. You may be bouncing back and forth. It might be pinging back and forth between 2 things, maybe, anger and depression, anger and depression. You might go back before you finally land on acceptance. But again, I like it as a model, sort of just to guide people, to let them know what the fact that they're transitioning through these different stages is totally normal. And most importantly, we're trying to get to the end, which is acceptance.
Absolutely. So the next question that I came across is, what should people not do when grieving? So I think this is a really important question because, yes, we'll talk about later on what people can do and how they can cope with it. But there's a lot that, naturally, I think when people are in a really sad, depressed state, they can reach for maladaptive coping, unhealthy coping, fall back into old habits. Sometimes old feelings can be triggered. So I'll say a few things as far as what people should not do. I would say this is maybe a should do, but I'll start with the fact that it's really important to reflect and not expect oneself to behave a certain way or expect the grieving process to be linear. There's no wrong way to grieve insofar as there's no wrong way to feel. And something that I often point out to clients is that relationships that were complicated in life are even more complicated in death because there's a lot of feelings of regret, remorse, unresolved feelings, unresolved whatever. So that's the first thing that I'll point out there. And as far as some basics, as far as what one should not do, don't engage in excessive drinking or substance use, especially if one has a history of this. Those old habits, again, can be triggered by a significant loss or a loss in general. And I would say also, don't dismiss your feelings. Allow yourself to experience whatever is coming up. So as far as what not to do, those would be the first things that come to mind for me.
Right. And that's what you said about the maladaptive coping and everything is the second thing I say. The first thing that you said is also the first thing which I say, which is there's no, like, let's say, prescribed way to grieve. Everyone's going to go through the process differently. And I say what you say, and I also say, make sure you have the right types of support. And because the thing is, I'm more often asked, or I used to be asked in the media, how do you help somebody who's going through grief? And I say there's no one right way to grieve. There's no one way to help people, but there are many ways to do it wrong. And so unfortunately, people with the best intentions, they usually come with the wrong execution. So, for example, for them, maybe getting back to work really quickly help them to sort of not get stuck in their head. So they're pushing somebody to go to work when their head, their body, nothing is saying that they're ready to go. Like they're still stuck in their grief and someone's pushing them to do that, or hearing platitudes, or, trying to find solace in whether it's faith or whatever else. If it works for you, just understand it may not work for somebody else. So I always tell people that, if they're trying to help somebody who's grieving, the only thing you can ask is, or the only thing you should say is a question, which is, what can I do for you? How can I be there for you? Right? That's it. So if you are the person who's grieving, I always tell them, I say, be prepared for that. And they're not going to know because it can seem annoying. Maybe you just want to be left alone, but they don't know that. And they have good intentions, we hope. And so they're coming in there, but kind of blind. So you have to guide them. I know, it's like, oh, my emotional labor. Sorry. I know you're going through a lot, but again, because there's no one right way to do it, it's about setting boundaries, and you may not feel able to do so. But that's the other thing. You talked about the remorse, all the other stuff that you can feel, the guilt and everything. Well, then people sometimes have that compounded by feeling guilty for not, let's say, responding to people who are trying to help, right? That complicates the grieving process. So I say, the thing is, in most cases, I tell people I say, don't add an extra layer of stress to what's already such a difficult process for yourself if you're grieving. I say, so the guilt part with the people who are trying to help, I say they'll probably cut you slack. Okay, right. So if you're trying to set a boundary, if you're just not responding, if you're, ghosting them or whatever, I say in most cases, people will cut you slack. The point is, again, going back to what you're talking about, maladaptive coping, I say it's hard enough as it is. Try your best not to layer on another level of stress, of difficulty, of complication.
And I guess what I'll add there is, yes, setting those boundaries is incredibly important. And hopefully most people who love and care about you will understand if you're not responding. But I think that there's a really fine line between setting those boundaries or not feeling up to responding and isolating oneself. Because that is something that can frequently happen, that people just push everybody away and isolate, which can then make those feelings a lot worse. So I'll throw that in there as well.
Oh, 100%. And that's one of the wrong ways to do it. The isolation. Exactly. You may need some moments of isolation, but to completely isolate yourself, we know that exacerbates depression and virtually any other issue. So yes, we don't want to do it extensively, but for those times that you do need it. And it's also, again, that's about boundaries. Maybe you open the gates a little bit, let people in for a day, maybe for a few days, and then you need a bit of time to recuperate, to be back in your head, to grieve the way that you need. But you're absolutely right. We don't want prolonged isolation.
And to add to what you said, as far as, I guess, what both of us said, that there's no wrong way to grieve necessarily, I would say also, while I did mention that general time frame that we look at as clinicians of 6 to 12 months, also don't hold yourself to a prescribed timeline. The loss it's going to differ. If, sadly somebody loses a child versus if they lose an elderly parent, that's going to feel very different. And the amount of time that it takes to go through that is going to be very different. Each individual is very different too. Some people are able to push through and bounce back more quickly, or seemingly, if, let's say, for example, going back to work is therapeutic for them, they may look like they're recovering faster, but the way that they're handling it, it looks different.
Right. And again, I want to stress so much that I think statistically, we will probably know more people who are going through loss than go through loss ourselves. If you think about it, if you have a large network of people. So I think it's so important to recognize, again, that this idea that people grieve their own ways. And I've had many patients whose partners, for example, let's say a patient loses their mother, and they're being stoic. Or maybe they didn't have such a great relationship with their mother, or they need to do work, or whatever the case may be. And the partner is, and it's usually, I hate to sound sexist, but it's usually let's say a woman saying to her husband or her partner, her male partner, why aren't you, let's say, being more expressive? Mm-hmm. Why aren't you letting why are you so stone cold? And it's like, you don't know what how the person's processing, and that might be what they need. It doesn't mean it's wrong. Not everyone has to have this moment of immense grief in going through the grieving process. So I see that so often. I really do see that for all their good intentions, and as you know, good intentions executed poorly lead to terrible outcomes. I often see the people around the person, as much as they try, they end up not. They're doing maybe a little bit more harm than good, or they're not doing as much good as they think they're doing. So again, don't push too hard. Don't assume that your way of grieving is the right way, or that, that people have to do this. And it's especially that emotionality. Now, having said that, if somebody has absolutely no feelings, or they don't express any feelings, they show no loss or anything like that, they're functioning really well and everything, and then they start exploding, or then they start, as you say, engaging in maladaptive coping, like maybe drinking more or gambling or doing something like that, then I hope that they're open to the possibility that maybe they're not processing it in the way that they thought they were, or as well as they thought they were.
Absolutely. So I guess let's move to the next question of, is there anything that can be done about grief? And this ties into a lot of what we're saying here, that, yes, there is, but you need to recognize that it doesn't look the same for everybody. It doesn't follow the same timeline. It doesn't follow the same pattern, structure, methods, and so on. But as a general framework, and sadly, in my clinical work, I've come across such tragic losses, from people losing their partners to their parents to their children to miscarriages. And in all cases, what I've recommended as a starting point is engaging in healthy self-care. And I sound like a broken record because I know I always say this, but diet, exercise, and sleep, if we don't have those three things in order, any number of strategies really aren't going to stick. So getting into some sort of routine where you are mindful of your sleep patterns, what you're putting into your body, moving your body at least once a day, is a really good starting point. We talked before about not isolating, so ensuring that you have some degree of social support that feels comfortable for you in those moments. And it often is helpful, and I, again, think this depends on the person, but leaning on others who are perhaps going through that same loss. Because while they may not be feeling the exact same way as you, they knew the person, and they, to some degree, are sharing that same experience.
Right. We are social animals. And I used to be asked as well in the media when let's say somebody died in some, tragic, accident or something like that, and a community gets together, or a neighborhood or whoever, and they, I have different opinions of that. Some people need that. Other people don't. They might think it's for show. They might think it's almost diminishing the person's memory, whatever the case may be. But the fact is, I always said that the healthy part of it is, as you're saying, this, connecting as humans, sharing the grief or the loss or the process with somebody else. But once again, the caveat being that if you two are, let's say, reminiscing about somebody, and one person, their way of doing of processing it is to find humor in it. They're trying to remember the good times and everything, and you're not in that state. You have to be mindful and be very open-minded, and know that, again, once again, that as much as we say other people have to be respectful of your grieving process, as you're grieving, you have to understand that other people will grieve in different ways as well. So, not everybody is going to connect with you over that loss the same way. You hope you find the people who can. Most people can. And to that point, I want to get back to this about there are so many wrong ways to support someone who's grieving. I say, no platitudes. None whatsoever, right? Just a hug, a smile, a sad smile. As I said, asking what I can do for you. Can I bring you some food? Can I, whatever the case may be. But again, it's when people try to, make either something profound or they're trying to console you through words, you never know how it's going to land. So don't try too hard. Connect in that, the human connection sometimes is just being in the same space, just being able to connect, with the eyes lock or something, or again, a touch, a hug, something like that. That can do far more good. And one more thing, when you talk about all the people that you've worked with, who've gone through such tragic losses, a couple of points about that. One, I've got to say, I've had a number of patients who, because of COVID, they were not able to properly grieve. They didn't have the ceremony. They didn't have the funeral, the wake, whatever that they needed, to be able to commemorate the person's life, to mark their passing. And so they're still feeling that there's a big loss there. They weren't able to. And in addition to loss, there's anger. They're angry at the government. They're angry at people who, maybe didn't try to circumvent rules to get, back into Canada or wherever to be able to, to celebrate or to commemorate. So, that there's a lot of complicated emotions around that. And that let's say the absence of the ritual. And I just want to sort of segue into the next point about that, which is we are social animals, but we're also creatures of symbolism. That's why we have these rituals. It helps. It's a transition. So it's a point. Okay, the person has passed from this life to whatever you may believe, whether it's exited or whatever the case may be. But it's a moment. It's a period of transition, and the people who are still here are also transitioning. Now we're going to the next stage of life without that person. So I tell people, whether it's a funeral, whether you have let's say mementos, pictures, whatever it is, you find something that you can imbue with the most let's say the heartwarming, the feelings. Now there's going to be, of course, it's going to be bittersweet. You're going to, if you look at the picture, or whatever, maybe it'll evoke tears or something like that, but it's just part of the process. You want to make sure though that it's not just something that's, if you look at a picture every time and it only brings you pain, then either it's the wrong picture or it's the wrong symbol. You find something again and you imbue it with the positive memories as much as you can. So it almost feels like that person's always there. Again, we are symbols. If you are away on a trip from somebody that you love and you're gone for a few weeks or whatever, and you don't have FaceTime or something like that, you're thinking about them. Again, that's the symbolism. You're still able to have some, you may feel a bit of longing, but you also feel the joy or whatever, the memory. So again, we have the capacity, our brains are designed in such a way that it allows us to capitalize on that. And so never discount the power of symbols and symbolism.
Yes, I'll say a couple of things there. And I guess to add into symbols and symbolism, leaning on one's belief system or religion, because that often has a lot of, maybe not answers, but at least guidance or direction in terms of the meaning of particular losses. So not being afraid to lean on that as well. But if I can go back to what you were saying about COVID and how that impacted people's ability to grieve. That really hits home for me and my family because we lost my father-in-law during the pandemic and weren't even able to see him in his last moments. So it's this weird feeling of our last memory of him was he was healthy. We were spending time together. We were having a great time. And then he's gone. So not only were we not able to engage in the typical cultural rituals associated with death, but we weren't even able to see him in his last moments. And I know, unfortunately, that story is not unique. So many people have gone through that. And interestingly, a lot of the nurses that I work with as clients, they were in a position where they had to deliver those last words to a lot of their patients. So even they experienced a strange type of grief that I don't think, at least in our lifetime, has been experienced before.
Right. And it is so difficult and it's maddening for a lot of people. And that's what I was going to get to as well. It's like not just the ritual itself, but the last days, weeks, months, sometimes not being able to see an elderly parent and so on, feeling helpless. And that's the thing is we are all powerless to stop the ultimate end for everybody. Right. So that sometimes for some people, the death of a loved one brings their own mortality or potential mortality in their face. For other people, it's the helplessness, and people don't want to feel helpless because that feels that you have no control. And we have no control over our death. We can extend our life as long as we can, but in the end, we don't have control over that. It's the ultimate loss of control. And I always say that the most important goal of all human functioning, of all species, is to master or control our environment. So something like this, it just robs us of it. And so COVID, did it much, much worse. We had no say, and the people who are supposed to be there to help us, whether the doctors or the government, they're the ones who are preventing us from being able to do what we need to do. So it adds a layer of complication. And for somebody who's trying to deal with loss, and I see this with my patients as well, it really, one of the things that complicates it is, as you mentioned earlier about that, like the regret, the remorse, the things that you weren't able to resolve, the unresolved issues that you have towards somebody, whether you feel bad about it, you feel guilty, or whether they hurt you and you were never able to, reconcile properly, or they never gave you what you wanted, they never apologized. So whatever the case may be, if one aspect of this, and I'm not trying to make business, but is proper therapy. And one of the most powerful techniques is something people can look into, and I won't get into it too much, but it's an emotion-focused therapy technique called the empty chair technique. It's also a Gestalt technique, where you put the person, and this is the important part I want to get to about complication, you put the other person in the chair, and the person, the patient has a dialogue with them, and you switch chairs. It looks ridiculous, but it's so powerful. And the point is, the reason I'm saying all this is, one of the goals of this technique is we're trying to parse the feelings. When someone has that person in the other chair, it's usually a combination of like either anger, resentment, betrayal, and hurt, loss, sadness, and they get combined. So what we try to do is we try to parse them out, deal with each emotion separately. Okay. And then afterwards, you're able to integrate them. You become more whole, more complete. And the problem is when people are, grieving a loved one, okay, they're often ping-ponging. They're not dealing with it smoothly. They're not integrating it. It's ping-ponging. So I'm angry that this person, let's say, committed suicide. But then, oh my gosh, how could I feel that way? So now they feel guilt, okay? And then, then they feel sadness. And again, they're bouncing. It's not transitioning through stages. They're ping-ponging, through among all these different emotions. And that's not healthy. They can't reconcile their feelings. So the reason I'm saying this is even if you don't do the therapy itself, earlier we talked about it's natural to go through these different stages. Well, to recognize that it's also just as natural to have mixed feelings. And if somebody passed away, they didn't kill themselves, they passed away, through no means of their own, they just happened to do it. Still, someone might feel angry, like I feel that you abandoned me, especially if someone has those types of issues. And then, but how could I say that they died? How could I feel that way? Again, it's totally natural to have quote unquote irrational feelings. Because it's because we're humans, we're irrational by nature. So anyway, just again, and why add an extra layer of guilt to your feelings if you're going through this process that again is totally natural to have these mixed feelings.
And to add to the mixed feelings, as far as what's come up more often than people would probably think is a feeling of relief. Sometimes a feeling of happiness, of like, this person was so awful to me, they were abusive, you name it. And then there's guilt that comes up with this natural feeling of relief. So again, to the point that we were making before, there is no wrong way to feel. Your emotions are what they are because relationships are complicated. And like I said before, if it was complicated in life, it's going to be even more complicated feeling in death oftentimes.
Right. And the relief, again, I know we're going to be dealing with this in another video about, let's say, complicated relations with parents. But even if the person did wrong, if you're their caregiver, if you have to go to their place every single day, you're working full time, you have a family of your own, and they have to do that, or taking them to all these appointments, or, like paying all these bills for something. Yes, it's okay to feel relief. And that's one thing with my patients, when I'm able to, give them permission. They don't need my permission, but it's like I see the relief on their face. Like I say, no, that's totally normal. You're not a bad person. Most people will say, okay, I'm only feeling relief because I know they're not suffering anymore. Well, that's part of it.
Yeah.
But again, it's perfectly human to be relieved that not having to deal with this burden anymore. And there's nothing wrong. I'm not, denigrating anyone's memory by saying that it was a burden. They may not be a burden, but the whole process was. So again, being realistic about our feelings is so important.
Yeah. And that reminded me too that recently a lot of the grief that I've worked through with clients has been regarding pets. And they
Mm,
always come in prefacing it with, like, I know it's just a pet. I know it was just a cat or a dog, but blah, blah, blah. And they have to explain, that close relationship. But I mean, me as a pet owner, I love my cats like they're children. I seem like, see, and I'm prefacing too, because I feel like I'm a crazy person how much I love my pets, but that's pets, right? I think pet
yeah.
owners do have that common understanding of the unconditional love and so on and so forth. But it's a very, very different relationship than with a human. And sometimes the loss can feel even more profound, I think, because of that unconditional love.
Exactly. Yeah. I mean, that's 100% what I was going to say is that unconditional love. Okay. Among humans, technically, it doesn't exist. You can say it, you can aspire to it, but in reality, even Carl Rogers, the person who coined what he called unconditional positive regard, even he said it's in reality, it never actually happens. Okay. That,
Yeah.
we're humans. So we can try, but it doesn't actually happen. So for pets, though, yes, there is. And so you're absolutely right. And that's, again, when we talked about sort of, the symbolism and so on, more people, I think people are more likely to put a pet's face on their body, like through tattoos, than maybe a person's face. I know some people do that, right, as well.
Yeah.
But but it's a great way. It's a great way to symbolize, the loss of a true loved one. And I always tell people when people say, as you say, like they feel embarrassed almost, I go, no, don't. I know quite a few people who didn't cry at their own parents' funeral, but they did with the passing of their pet. And I know how devastating. I'm going to get emotional now, like with our beloved Rusty, 18 years and 2 months old, our dog, and and we had like just the process was just. Yeah, I saw what it did to my whole entire family, and that to me was like that's hard enough dealing with the loss myself, but seeing my family go through that. So again, I tell my patients, never ever feel bad or crazy or never apologize for
Yeah.
grieving your pet, even if it's more than a human.
And it's tricky because I think, this applies with pets mostly, but I think in relationships in general, that oftentimes when people go through such profound grief, they are afraid to then love again or get another pet or get into another relationship. But it's such an interesting dichotomy because I think that in many cases, the greater the pain and the loss, the stronger that relationship was. So it's such a paradox of, well, you're going to feel incredible pain if there was incredible love.
Right. And, still saying, what is it, better to have loved and lost than to have
Yeah.
never loved at all. So,
Yeah.
again, it's about framing and it's tricky because emotions will override logic in most cases, but the only way to help heal is through the capacity that we have to frame things in ways that are the healthiest. So it's not about making excuses, not about rationalizing. It's not about platitudes, but it's being able to frame your either the loss, okay, the love you had for the person before the loss, moving forward, the whole process and everything is framing it. It's how you frame it, and that will determine to a large part how well you're able to get through this process. Because one of the things as we're talking about this, one thing is that people are so afraid. So if they lose, let's say, whether it's a partner, whether it's a parent, whoever it is, or a child, God forbid, they think that if I one day find happiness, if I move on, if I am able to be myself again, am I somehow desecrating the memory of the person? Because how can I go on with joy when I've lost the love of my life or whoever that person is? And I say, no. And I always tell them, I say, that person, do you think that they would, if they loved you, do you think they would want you to spend the rest of your life suffering?
Mm-hmm.
No. And that's framing. And I tell them, you have to do it. You're doing it for them. That's the symbolism again. You say, I'm doing this for you. Okay. For us, for our memory and so on. So I can't, again, that'll be the drinking word of the day, today, framing.
Yeah.
It's how you frame the experience.
Yeah. So the last question we'll explore here is how long does grief last? So we've kind of had this interwoven through all of our discussion here, but ultimately it does vary across situations, across cultures, across relationships. But if symptoms, and again, this is how we would look at it and how we would frame it as clinicians, but if symptoms have lasted at clinically significant levels for 6 months to 12 months, it's worthwhile seeking out professional guidance, professional help with it. again, there's no specific time frame like we've said, but looking at the severity of symptoms, if they've lasted severely for that amount of time, that's probably your sign to go and get looked into a little bit more further.
Right. And as with most, let's say, disorders or issues that we deal with, it's is how is it affecting you internally and also externally? If it's affecting, if you're not able to work, if you're not able to be there for your family or whatever, those are the markers. And again, it's these are not carved in stone. These are guidelines that a number of psychiatrists and psychologists get along, get together with, do some research, use some clinical expertise, and determine. And it's kind of arbitrary, whether it's 1 month, 6 months, a year. So, and again, so it's only guidelines, number one. And number two, this whole idea of being able to, again, support, you get the support, whether it's your loved ones, community, faith, whatever, or professional support, and B, trying to move forward. And that's how you frame it. Whatever I'm doing, I am doing this so that I can continue to move forward. And there was one other part about that. Again, we said this before, I'll say it again. It's like, don't have expectations, even though these are timelines that, that experts, quote unquote, have have described. If that doesn't fit for you, it doesn't mean there's anything wrong with you. Like somebody, for example, I've had a number of patients where it's actually quite interesting. The anniversary of the death is coming up.
Yes.
Okay. And it might be, it could be the first time, that's going to be some of the hardest, but it could be 10 years later. And they didn't even recognize that it was the anniversary, but they were feeling really down. Yeah. And I say, again, that's, you may not be consciously aware of it, but somehow your body knew that it was connecting, whether it's around Christmas time or the season or whatever it is, your body knew this. Yeah. And so again, it's the frame. It's like, oh, okay. And they thought, but it was 10 years ago. How could I? It's, again, we're human beings. We're not entirely rational. So even if you have a setback years later, right, then you frame that as, okay, it doesn't mean, oh, I'm still harboring this loss or whatever. It just means, wow, this person had a really profound impact on me. I'm sad that they're gone, but I'm going to try to cherish the time that I did have with them. Again, frame.
Yeah, I'm so glad that you brought that up because I forgot. And then as soon as you mentioned it, I'm like, yes, I would say almost consistently when a client is like, I'm just not feeling quite right and I don't know why, almost always it's tied to some anniversary of some loss or, sometimes a trauma, but oftentimes a loss. And yeah, consciously we may not be thinking about it or recognizing it, but it's stored in the body and the body does remember such things. And also, like you said, the first year is usually hard and, it's not the hardest per se, but the first birthday, the first anniversary, the first Christmas, and so on and so forth. Just allowing oneself to, feel that loss during those times is completely okay. And it's something that one should do.
Right. And conversely, when you feel it less, okay, and it's funny because it's an irony, because when people are going through such profound loss, they want nothing more than to not feel this way. Right. And so, and I've had patients ask me, when is it going to end? When is this pain going to end? And I say, well, I don't know. We're working toward that. And then when it finally does end, then when an anniversary of the loss or what a birthday or whatever comes up and they don't feel terrible, now they feel guilty. Mm-hmm. But wait, like, why am I not feeling this loss? True. And I say, again, it's another layer of complication. It's unnecessary hurt that you're putting on yourself. I say it's natural. That's a good thing. You're not forgetting them. It just means you're healing and that you're able to move on in a healthier way because still symbolically they're up in your head. Yeah. I'm not remembering their face as much as I used to before. Okay. All right. Fine. Then maybe that's a sign saying that you've got to focus on other things. You may not remember their faces clearly, but again, whether it's a memory, whether it's a memento, somehow they're still with you. They're still a part of you. Once again, frame. And one other thing, final point, you mentioned it. And I say this to people and I kind of use this as the anchor. And God forbid, I know it happens far too often, but I say, and if anyone who's watching this has gone through this yourself, if this doesn't apply to you, then I am so happy for you. But, and I'm not trying to make things worse for you, but people ask, there was once it was a TV show, and I don't mean to cite it, but, I think it was a Swedish show, and there was one line, I thought it was just so, it resonated. So someone had lost the child was murdered, okay, and then someone else, they meet someone whose child also was murdered, and they asked something like, when does the pain end? And the person just says never. Yeah. Okay. And so when I'm explaining this to people, I cite that as well. And I say, I'm normalizing it, right? If you lose a child, our brains aren't wired to accept that. So if you do, you'll expect that you're going to carry that pain forever. But The fact is, we all carry some type of pain. So we try to compartmentalize as much as we can, but recognizing that still, things will never quite feel the same. It's the worst loss, like people may argue, but to everything I know, it's the worst loss because, again, we're just not used to it. Parents aren't supposed to outlive their children. It's not the way it is. Okay. So once again, if someone feels that way, it's like having a catastrophic injury where you're never going to work again. You're never going to be the person you're going to be again. There's no words that can make you feel better. You can just be there for the person and encourage them to try their best. And, it's like having, I don't know if I said this before, on the podcast, but with some patients, I say, it's like you're coming in with a plastic bag over your head. And all I'm doing is taking a little pin and pricking a few holes. And when people hear that, they appreciate that. It might sound gruesome imagery, but again, it's symbolism. They recognize by saying that no matter what I say, I'm not pretending I've done a great job. Yeah. They're going to walk out of my office now feeling better. I'm saying, no matter what I do, you still are suffering. And all we can do is try a little pinprick here or there. And that type of recognition of what they're going through, that's empathy. Platitudes are not empathy. That is.
Yeah. Yeah. And as you bring that up, I feel like we could talk for probably another hour about grief when it comes to, major changes in life and, accidents, loss of limb, loss of a job, it goes on. But I guess the point is a lot of what we've spoken about today does apply in those situations as well. But to our listeners, I'd like to know, what are some of your questions about grief? What are some of the complicated things that have come up regarding grief that we can maybe talk about in another episode?
Right. And again, for everything that we could talk about this for a long time about these different things. So all I will add to that is, so for somebody, if you have, again, lost a job or had a major change in your life that is a loss. Okay. Or again, that your parents weren't there for you or someone didn't support you or protect you or whatever. Okay. Just recognize that, that is a type of loss and you can treat it this exact same way that we've been talking about, which is recognizing what it is, not making it overly complicated, more complicated than it already is, framing it properly, and most importantly, trying to get to a place where you can transition to the next stage where you can keep moving forward. And I know we always talk about, what can people do? We usually end with what can people do about this, but we've been doing this throughout the entire podcast, right? So, All right. So on that note, until next time, keep your eyes on the road and your hands upon the wheel.